Ms. Vera, what were you suffering from when you came into our office for the first time?
Numbness in my legs, heat in my feet, and pain in my thumb area.
Okay, so neuropathy.
Yes.
Can you explain to people watching this video how your life was affected? What are some things that you weren't able to do?
Walking, I was afraid to walk. I didn't realize I was afraid to walk until after I came here and started treatment and stuff, you know. Just
What was the story that you were just telling me about stepping over the rocks where in the community where you live?
Well, where I'm always, like, all my life I had fallen, and I always thought it was just because I was clumsy until you did the test in the office and told me it was my cerebellum, and where I turned, and now I realize that my balance is better. Even, like, the first day after my first treatment, I could tell a difference in how I felt.
Yeah, and through the treatments that we've been doing, we've been working on basically stabilizing all of the neurology that is being affected through your neuropathy. So not just the cerebellum, but also your peripheral nerves as well.
Right.
So how long have you been under care at this point?
2 months.
And could you explain to people the results that you've seen so far? And like you said before, you're going to try not to cry, but you can cry if you'd like.
When I came in, I was very emotional. I was because I didn't realize how off balance I was. 2 weeks before I started coming here, I had fallen, and like I said before, all my life I have fallen, thought it was just because I was clumsy, and I realized that since then I've stumbled on rocks and stuff, and I'm able to catch myself. I don't fall. I haven't fallen, and my daughter works with me, and she noticed after 2 weeks of me coming here that I wasn't complaining about my legs being numb and the heat in my feet, because I would come home every day just so tired. And when I would go to the grocery store, I would grab onto a cart because I didn't realize how afraid I was just to walk, because I was afraid to fall. And now I can go in the store or wherever and walk more, and I don't have that fear of falling.
To me that brings tears to my eyes, because basically
I'm not as much. And the other thing I realized is that when I started coming here, I didn't realize that I wasn't sleeping good until, like, the first day I left here after having treatment. I was like, by 9:30 I was like so ready for bed, and for the whole first week I was just sleeping, and it was like, wow, I just felt better because I was sleeping more, and I just a more restful sleep, I should say.
Excellent. So
I'm not as emotional as I was when I first came in. The first couple of times I was crying, and I didn't know how off balance I was, and I just I'm very grateful.
And I'm truly happy for the results that you're getting. I'm proud of you for working as hard as you've worked to work together to help get you better. And here we are 2 months into your care. Not only symptomatic improvement, but balance and stability drastically improved where you're more stable. And for me as a doctor, that's one of the most rewarding things, especially when falls are pretty much the number one cause of death in this country. Nobody wants any instability. You want to be as stable on your own 2 feet as possible, and we helped regain that for you. And I feel very honored for you to be a patient here.
Even my daughter noticed, the difference in how I am,
Excellent. Is there any message that you'd like to send out to anybody watching this video?
If you feel any numbness or any unbalance, this is the place to come. They treat you really nice here. The girls are awesome. Dr. Zuckerman is awesome, and I just am so happy that I found this place.
Thank you so much for sharing your story.
Thank you.